Hello, everyone. Dr. Jack Wolfson, cardiologist. Welcome to day number 19 of Happy Heart Month. Great to see everyone jump in, say hello. I'm going live on StreamYard, so we're streaming into the Facebook page, the Facebook group for Natural Heart Doctor, and also onto Natural Heart Doctor YouTube. Welcome, 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 everyone. Dr. Jack Wolfson. This is day number 19 of Happy Heart Month. Board certified cardiologist, natural heart doctor, your home for the 100 to your heart. Again, jump in, say hello, and we'll get started today. Today's topic is all about testing. Test, don't guess, and we're going to be talking about advanced cardiovascular testing. And if you're here live, it is probably Saturday morning wherever you are, although certainly we have a lot of people who are interested in heart health, who are part of our group at Natural Heart Doctor, and they're from all over the world. Europe, Australia, New Zealand, Asia. I just saw patients, this week in the office, and I was slam packed. It was absolutely fantastic, and just such great people. It's and as I said, it's one of the best things about my job and my new career is the people, and the rest of my staff feel the same way. So I actually had a father and daughter who are Korean, and they read my book in the Korean version, courtesy of my chiropractor friend in LA, Joshua Cho, who got my book to a Korean publisher, and the Paleocardiologist is published in Korean. And I was able to see them and help them, and it was very exciting. So again, welcome to everyone from all over the world. Natural Heart Doctor, you're in the right place. This is day number 19, Happy Heart Month, and you're tuning in because you want information about the best in heart health, the 100 to your heart. And today in particular, we're talking about test, don't guess, and we're talking about the advanced cardiovascular analysis. Good. Hello from Boise, Minnesota, Vancouver, Arizona, of course, East Texas, Laura Beth Sheets, and Bill from sunny Colorado. Is it ever going to snow in Colorado again, Laura Beth? What do you think? Let's see here. And again, welcome to everybody. So what I want to talk about today is that, and I'm going to do a share screen so we can do some of this here. Let's share screen. And I hope my audio is looking sounding good. There is some background music where I am at. And I'm on the share screen right now. Laura, great to see you. Hello from California. Okay, so let's get in here. We're on share screen, and then we'll take some questions at the end for anyone who wants to take part. Here we go. Natural Heart Doctor. Test, don't guess. A lot of people take supplements. A lot of people eat a certain way. A lot of people live the certain way. And I think that's all fantastic, and that's the majority of the battle. But how do you objectively look or assess at how you're doing? And that's where testing comes in. So, of course, cardiologists do regular, routine, standard tests, and I do the most advanced tests in the world. And that's what I'll be telling you about today a little bit, again, because this is Happy Heart Month. There's so much to cover. I just want to give people a tasting of kind of what we do at Natural Heart Doctor and what we have to offer. And then, of course, we can go deeper, as time permits in the future. And I'll be doing some more. I'm going to be going through all these different tests over the next few months, and I'll be going them very, very in depth, creating videos, audio for people to, look and listen. So today, again, these are kind of some of the tests that we run in our office. Advanced Cardiovascular Panel. We'll talk about some of that this morning. The micronutrient, intracellular vitamins and minerals, leaky guts. Leaky gut equals leaky heart. We do the triple toxin test for mold, metals, and environmental toxins. GI effects, something called the IBS SURE to see if you have SIBO, small intestinal bowel overgrowth, as a cause of your symptoms regarding your gut, heartburn, bloating, gas, constipation, diarrhea, abdominal pain, you name it. We do these tick-borne panels. We talked about that a couple days ago. We do neural testing, where we're looking for antibodies that could be attacking brain tissue, leading to brain disorders, Parkinson's, Alzheimer's, movement disorders, tremors, organic acid testing, again, to identify other nutrient deficiencies. So today let's talk about advanced cardiovascular testing. And when I talk about advanced cardiovascular testing, these are all the things that are on my routine panel, which if you will look at it, you will see that it's much more extensive than anything that conventional cardiologists are doing. So advanced cardio, let's talk about kind of part one of this. We're talking about cholesterol, lipid particles, triglycerides, LP little a. So this is the advanced cardiac panel of what we do. Over in this particular situation, over on the right is before, and here we are now. And in any case, what we're looking at is the top panel is the 1970s panel, that total cholesterol, triglycerides, LDLs, HDLs. But what really matters is the second part, where we look at those apolipoproteins. And the apolipoproteins are really what matters and what we need to know, because the most important cardiovascular risk factor when it comes to lipids is actually that ratio that you see on the screen, ApoB, ApoA1, and you can see now we're at 0.78. Previously, we were at 1. So we're looking at that. And then we can also directly measure SDLDL, small dense LDLs, and then we can measure something called LP parentheses little a. I'll talk about that. So here's your cholesterol molecule. Cholesterol, it doesn't contain any toxic metals. It doesn't contain mercury or lead or arsenic or cadmium or anything. It's just oxygen, carbon, and hydrogen set up in a certain way that it really forms like this waxy-like substance. And this waxy-like substance helps to create barriers in different organs. So for example, every cell has a cell membrane, or the fence that surrounds the cell. And it's called technically a lipid bilayer. And I don't want to get too into that, but what that is, that lipid bilayer, you can see on the screen right there, that lipid bilayer, again, it allows things to get into the cell that belong, keeps things out of the cell that don't belong. It is a very important structure. Obviously, it is the brain of the cell. You can see on the screen in the lime green balls, that is cholesterol. So again, cholesterol has a very important role in many different things, including that cell membrane. And of course, I talk about this a lot in my book, The Paleocardiologist, about the purpose of cholesterol. But for this demonstration, I do want you to look at those yellow balls. Do you see all those yellow balls on there? The yellow balls are omega-3 fish oil. They are eating seafood, which, as you can tell, that is why we need to eat seafood, so we can have those high quality yellow balls in there. Now, if we look at total cholesterol, which everybody wants to know about, what's your total? What's your total? It's actually a very poor predictor of all-cause mortality or life or death, in the range of, because essentially anywhere between 160 and 260, your all-cause mortality is about the same. Once you start getting to the extremes of above 260, your death rate increases. And as you get below 160, your death rate increases as well. So you want to be ideally somewhere in that sweet spot, 160 to 260. And if you look at one of the most famous surgeons in the history of the world, Dr. Michael DeBakey, who has since passed, and he said, this is years ago, an analysis of cholesterol values in 1,700 patients with atherosclerotic disease revealed no definite correlation between serum cholesterol levels and the nature and extent of atherosclerotic disease. Again, total cholesterol is a poor predictor. We measure it because it's there and people want to know. Honestly, I don't even look at it. I don't even look at it. What matters, and it's black on the screen here, I apologize, LDL and HDL particles, these big fluffy balls or these buses that are floating through the body. We want to know about the number of particles and the size of the particles. And here, this actually goes back to 1979. Our apolipoproteins, better discriminators than lipids for atherosclerosis. And lipids meaning total cholesterol. And the answer is yes, yes, and yes. This question has been answered over and over and over. In fact, this is data from Dr. Salim Youssef from 2004. And what they showed essentially is that apolipoprotein BA ratio, as the number goes up, so does your heart attack risk. And that's just totally linear. They looked at a lot of patients, a lot of data. And again, the lower the ApoB, ApoA ratio, the lower the risk of having a heart attack. So that's what we measure at Natural Heart Doctor. Another study, again, look at this is 2011. ApoBA is an effective predictor of coronary heart disease risk in overweight and obesity. More data. High ratio, the highest ratios, triple the stroke risk. We got to know your ratio. We got to get it down. That's from Journal of Cerebrovascular Diseases in 2006. Now, triglycerides are also important. Triglycerides are how we take food and we transport that food around the body. And again, the higher the triglycerides, the higher your risk. I do like triglycerides as a measurement. And of course, we lower it down and we improve all of our numbers with everything that we do at Natural Heart Doctor. And finally, when it comes to lipids, we want to know this here, this LP parentheses little a. And on the left is an LDL particle, and on the right is essentially an LDL, but it has this extra protein on there called apo parentheses small a, and you can see it on the screen, and that is essentially, it's like razor blades on the LDL particle. Check this out. This is from 2007. Extreme lipoprotein A levels predict a 3 to 4-fold increase in risk of MI. We need to know if you've got LP parentheses little a, and we need to do something about it. Pharmaceutical companies, they're working hard to develop mRNA technology to go after those particular proteins. Why don't we try and do it naturally, and we'll see who comes out better. I think we'll do better with nature. LPA is linked to high blood pressure as well. LPA is linked to stroke risk. And again, test, don't guess. This is the purpose of either asking your doctor to order the most advanced cardiovascular testing in the world or asking us at Natural Heart Doctor. Advanced cardiovascular testing, these are the markers of inflammation that we check. High sensitivity CRP, oxidized LDL, which is a measurement of damaged LDL particles, MPO, PLA2, phospholipase A2. Again, each one of these deserves a 1-hour presentation just on their own if someone is so interested. I love talking about it, as you can tell, because I love helping people. Inflammation is what we measure. Inflammation is the body on fire. Cardiologists know this, but they use aspirin and statin drugs and blood pressure drugs. We go after the cause of inflammation. Markers of inflammation, this is my quote, inflammation is a much greater risk factor for cardiovascular events than lipids. So again, if I had one thing to check for, it would be markers of inflammation. That's how I would determine health. Inflammation is linked to high blood pressure. Inflammation is linked to stroke. Inflammation is linked to everything bad, as you see here on the screen. Heart attack, stroke, AFib, high blood pressure, cholesterol issues, cardiomyopathy, heart failure, dementia, cancer, early death, you name it, inflammation. If you are inflamed, you have a higher risk of hospitalization and death from COVID. Markers of inflammation, and this is what we check for in this particular panel. So again, it's just fantastic information, and happy to provide that to everyone here. And I'm going to stop the screen share. And now we are, Bob Hunter, yes, please put together a presentation. I'm going to, Bob, thank you. Angela, great to see you. Lynn Rhodes, Carthage, New York, snowy, good for you. And so someone's asking if my ApoB is moderate and but my ratio is 0.45, I don't worry about the B. That's pretty much correct. If your ratio is good, then there's nothing really to be overly concerned about. I do want to know your markers of inflammation to make sure they're both in line. But again, I showed you, the only thing that matters is the ratio, because if you've got a lot of Bs, which are attached to fluffy LDL particles, that's good. If you've got a lot of protective HDL particles, that's good. I think there's always more to the story that we could delve into. But again, in general, I showed you the data. The lower the risk associated with the lower BA ratio. Maria, hello from Texas. Tahir, hello from California, Westlake Village, Bob Hunter, a lot of great people in here as well. Laura Beth, you never answered me if it's going to snow in Colorado ever again. Let me know. Okay, so what else can I tell you? We've gone 15 minutes. We've got great information. Don't forget that I'm going to give you the word of the day. You take the word of the day and you put it into your calendar. You email us the calendar. We give you a $50 gift card over here at Natural Heart Doctor, and you get entered in for the triple toxin combo. 3 lucky winners, review with Dr. Lauren Latanza. Listen, this is just our way of trying to further incentivize you all to learn this stuff, because that is my passion. I saw, again, fantastic patients in office all week, people who get it, people who want the best in heart health, and they want the 100-year heart, and that's what we want to be able to give to people as well. All right, Laura Beth, March is coming. Okay, good. So let's see here. I'm going to pull up the word of the day, and the word of the day today. Oh, what a wonderful, wonderful word of the day. What a wonderful word of the day. The word of the day is family. Family, family, family. I love these word of the days because I made up all the words. I came up with the words for Natural Heart Doctor, along with my fantastic team that you all already know, Amanda and Carrington and Christina and Ashley and Laura Beth and Laura Beth, it seems like, right? Laura Hill and Allie Richmond and Chuck and his team down in shipping, receiving, and operations, and my I got some great new staff members too. We lost somebody recently who moved on to a veterinary clinic, but we picked up a new person. Her name is Hannah, and she's going to be the director of operations in Scottsdale. And we have Nylea, and we've got Michelle, and we've got Kelly, and Kelly's a new assistant phlebotomist. So anyways, I'm kind of going on family. This is, that's like my work family. I am in a building right now where my nuclear family is at, and my wife and my 4 children. And again, all of you are part of the Natural Heart Doctor family. I hope you feel that way. I hope you feel that we are all family. A lot of us over the last couple of years, especially, but just because of our belief system about health and wellness, about the world in general, about our freedoms. We've lost some family members. We've lost some friends, and to them I say, I love you, bless you, I appreciate you, I appreciate the path that you're on. I cherish all of our memories that we've had together. They're wonderful, wonderful memories. But again, those are just memories in the past, and moving forward, I choose to be with people who share my vision and my passion and my desire for a better world, again, in my vision of that and my version of that. So other people see differently, and that's okay. I'm rooting for my side. I'm glad we're all together in this. And again, I appreciate all of you. The word of the day is family. So we're going to come back tomorrow with a nice, healthy discussion. And I'm going to get a little more granular. I'm going to get a little more in depth on this one because it's very, very important. And that is about the dangers of CT scans. I see a lot of people who come in because they've had a CT scan and the CT scan shows it's abnormal. And again, we're going to talk about the risks of CT scans. We'll talk about any potential benefits of CT scans. We'll talk about what to do if you've had a scan and you have a result of calcification, blockages or not, and we'll talk about that as well. So, again, I'm Dr. Jack Wolfson, cardiologist, natural heart doctor, the home of the 100-year heart. Replays coming today. Amanda Noel Scoggin, you love that too. Word of the day, family. You're a good family mama, for sure. And, Juan, we did talk about water, alkaline, non-alkaline. The water that we promote is on our website, naturalheartdoctor.com/water. It is the most pure available water. Good stuff is added back in, and it is alkaline and done in an appropriate way. Lynn Rhodes, we can talk more about MRI tomorrow. Stay tuned tomorrow. Okay, we'll talk some about MRI. Don't forget to ask me about MRI. I'm not specifically going to talk about it unless it pops into my brain as I'm speaking. But again, we're going to talk about CT scans. But please ask me about MRI. Francis Weller, what are your thoughts about fatty acid testing? Again, like I didn't even scratch the surface. I touched the surface today of testing. And yes, we do fatty acid testing on anybody and everybody. Extremely important. How do we know what your levels of omega-3s are if we don't test? Test, don't guess. All right. Have a wonderful day, everyone. Dr. Jack Wolfson, natural heart doctor, home of your 100-year heart. We will see you tomorrow.